Hi folks, today I'm going to go over Clinical Vignette Part 1, which is due Sunday, week 4, so that's not this Sunday, but next Sunday, February 12th. So this is the first part of a two-part clinical vignette. And this assignment, you'll select a person whose subculture is different from your own. If you do not have a current practice case, which for many of you, you may not be in the field, from your introduction videos, it seems like a lot of you do have experience in the field, so you can pull from a case that you're familiar with. It is possible to use a case from past practice, literature, or film. However, if you do the latter, so if you do pick something from literature or film, please discuss this with me. And before you do that, before you email me with your idea, just make sure, go through the rubric, make sure that you will find something that is going to fit all the criteria. It doesn't have to answer every single question, but the big ones you're going to want to be able to complete. For mine, when I took this course, I did not have any experience in the field, so I actually did Bertha Mason from Jane Eyre, who was Mr. Rochester's actual wife, and I actually was able to find a book that was written about Bertha Mason to gain more information, and I found out a lot more. So if you can find a character who has a lot of information about them, the better off you'll be, and the less anxiety you'll have about filling out all of these pieces. And again, Anita's case example cannot be used for these assignments. We're going to talk about her a lot, and it won't be appropriate to use her for this assignment. If you scroll down, you can see that the rubric is down here. I'm actually going to use the rubric rather than using these bullet points because the rubric actually provides you with a little bit more information. And you can see here what the grading breakdown will be. I also apologize if you can hear my cat crying in the background. She gets really upset when I'm just sitting in here and she's not in here. Okay, so the first part, and you can break this down by paragraph, just you're going to want to make sure that it's in APA format. So your introduction, explain your role with a client and in what context you work with this person. If you do use a fictional character, you can still say that you're working with them in a therapeutic setting. The next piece is data sources used for the report. Who was interviewed, what documents were reviewed, and any other sources of information. What is the source of the referral? Identifying information. So this is the descriptive snapshot of the person currently. Name, you need to use an alias, especially if it's a client that you're currently working with. You need to make up a name for them, and you need to note that you've changed the name for confidentiality purposes. I will be looking for that. And then you'll include age, gender, race, sexual orientation, nationality, religion, relationship status, children, ordinal position in the family of origin, education, socioeconomic status, occupation, and current employment. If you don't have any of this information, or if you are missing certain pieces, make that known. So if you don't know what position they are in the family of origin, you can state that. Next is a presenting problem. This provides a concise description of the presenting problem. What was the problem when the person presented for services? And then going along with that, the chief complaint. Stated in the client's own words or summary of client's view of the situation. So your client comes in and tells you what's going on. What is the view of the problem? Next, the presenting problem description. Describe in detail the history and context of the problem situation. Is a problem of recent or long-standing origin? Describe the course of the problem development. When did the presenting problem begin? What led up to the presenting problem? Did the person request help, or were they mandated to receive help? What is the client's expectation for help? What is the client's expectation of help? So for example, if you're working with someone who has an alcohol problem, and they are looking to get into recovery, you can talk about they came to you and they stated that the problem began X amount of years ago when this happened in their lives. And, were they mandated, were they court mandated to receive help? If not, they want to receive help voluntarily. And what is the client's expectation for help? Do they want to get clean, or do they want to just receive therapy? Like, what is the situation? Brief history of the presenting problem. So you can break this down. Make sure you're using headings and subheadings that is appropriate for APA. The background of the person's childhood to current age regarding family system, school, potential trauma, grief and loss, etc. So this could be 2 to 3 pages. Their supports. What are the client's strengths? What has been done about the problem? What are the client's personal, social, community resources? How does the client utilize resources? Supports is really important. As social workers, we come across a bunch of people from a lot of different backgrounds, and they can challenge us sometimes, and sometimes we don't always see the strength in our clients, but it's really important to find that, because we are a strengths-based practice. And in the past, when I've taught this class, some students have struggled with finding the strengths, but just think about it. How does the client help themselves? They've maintained the way they have for so long. How do they keep going? And then next is your view. What is your view of the problem? What are your expectations of the client? Next will be current diagnosis and medications. So make a list of the person's current diagnoses. If the person doesn't have a current diagnosis, you can say that. And list the associated medications. If they aren't on medications, you also say that. And then state whether you agree or disagree with the diagnosis and why. And then you will do signs and symptoms and rationale. So again, I talked about rationale for week 3 with Anita's quiz. So you're going to be doing a lot of rationale, especially in this assignment. So you're going to do the assessment using the DSM-5. So you're going to define the person's challenging behaviors and other behavioral manifestations of possible symptoms and/or actions of the person. Say what behaviors may relate to symptoms, signs and symptoms of diagnoses covered from sessions 1 through 3. So that's substance-related, PTSD, and anxiety disorders. Assess the person and determine 2 to 3 possible differential diagnoses using the behavioral manifestations to support the symptom choices. Again, if you're having some confusion on what behavioral manifestations are, signs and symptoms, or differential diagnoses, go back to the assessment video that Dr. Jenny Focknew posted, and it was required to watch for the first week. And lastly, give a rationale for each of the differential diagnoses. Why did you pick that? And lastly, make a list of ruled out diagnoses. Why are these ruled out? If you don't have any ruled out, just make sure you say that known. You make that known. And again, use APA format. You don't have to make an abstract for this paper, but do make sure you have a cover page and a reference page. And make sure it's 12-point font. This is like a class that you're sending the papers to me, so I'll know that if it's not. I think that's really it for this assignment. But as always, if you have any questions, send them my way. I'd be happy to help. And if you do decide to use a fictional character from literature or film, or a real character, like a historical figure from literature or film, still let me know so I can approve it for you. Okay? I hope that you have a good week. If you have any questions, let me know.